I'd like to welcome everybody here today on behalf of Changing SCIU, HCAN, and Progress Ohio. We are holding this press conference today to talk about health care during the time of crisis in Washington, crisis on Wall Street, crisis on Main Street, and I would say today, crisis on Oak Street. And by that I mean, I think people are forgetting that outside of Main Street and Wall Street, there are people hurting right now on Oak Street, we will call it. We are here today to talk about health care benefits and health care planning in Washington. And one of the concerns going on right now as we talk about Washington, D.C., and we talk about this study today with many experts, is that many families are struggling because of the cost of health insurance as we have it now. In fact, Ohio has 1.1 million Ohioans who are without adequate health care or are underinsured in health care, which is an important distinction. There are plans in Washington right now, some of them advocated by Senator McCain in his Senate work, that have been put forth in studies. These studies have indicated that, again, going with this sort of laissez-faire free market approach that has led to the disaster on Wall Street, that if these policies are enacted, the incentives for many businesses to provide employer-based health insurance will go away. By doing that, and going to a tax credit system of health care funding, the tax credit system, and I want to make sure that individuals understand this, and the experts could go into detail, but by tax credit, that would mean, you know, your employer no longer gets a tax break for providing health insurance. And so if your employer does not provide that health insurance, you would, all Ohioans and all of the people in the United States would wind up having to pocket the pay of health insurance out of their own pocket, and they would later get a tax break. Now, since we are talking about Wall Street and Main Street, for the average person on Oak Street, that would mean that you would have to be able to come up with the money to pay for your health insurance up front so that later on you can get your tax break. And because of that, these proposals in Washington, D.C. would be disastrous for Ohio's already struggling economy, and as these experts today will come in and tell you, could cost Ohioans $922,546 Ohioans their health insurance. So, while we are worried about bailouts and we are worried about all these television commercials and all the back and forth going on, come January there is going to be a lot of discussion about health insurance, and the groups that we represent today are extremely concerned about some of the rhetoric coming out of Washington, including those of folks, including Senator McCain, that would advocate actually costing 922,546 Ohioans the loss of their health insurance, and many other Ohioans who are already struggling will be forced to pay up front for their health care and wait for a tax break. And those things could be disastrous for Ohio's economy. So I am oversimplifying it. We have experts here to talk about this study in much more detail, but Ohioans beware. Come the debate in January, there are some of these same types of ideological arguments that have destabilized Wall Street that can destabilize your health insurance. With that, I'd like to introduce first Lisa Hetrick, who is the Secretary-Treasurer of SCIU District 1199 in Ohio, Kentucky, and I believe Indiana. West Virginia.
Good morning, everyone. Again, I'm Lisa Hetrick. I'm the Secretary-Treasurer for District 1199 SCIU. We represent about 30,000 healthcare and social service workers throughout the 3 states, Ohio, West Virginia, Kentucky, but however, our biggest concentration being here in the state of Ohio. And I personally negotiate the state agreement, 4,000 members who are employed by the state of Ohio. So again, they have health care coverage provided by the state, but again, under this plan, the seriousness and the radical plan could really be dangerous for us and all of our members. I really feel in some way that I'm here not as, political motivator, but here as the face of healthcare and what this plan represents. And I feel that my being here was not an option. A couple of years ago, I was diagnosed with cancer. And of course, nothing that I wanted, nothing that I ever asked for. But really, like you all, at some point in your life, I totally believe that you will be faced with a family member, a friend that suffers through this. And I was very, very fortunate to have an employer that was able to sponsor, and has work insurance that I can get, because at the end of all of this and through the crisis, I don't know as a person how I could have possibly managed what was going to happen to my family. I'm Oak Street. I live in a very tiny town, travel here to Columbus to do my job, but really, I'm married, I have a single child. Really never thought that these kinds of issues would I ever be confronted with. Have health care, an employer that fights hard to make sure that that does happen, and really, if there was going to be any illness along the way, why would I really, care much? Might be a deductible, might be a copay, but in the end, very confident that I would have those, and now I am not confident that those things are at play. When you talk about the taxes, there's actually a disincentive now under this plan, for small companies not to provide health care. And when you look at where I work at the union, we have only 80 employees. So in my mind, that's small. That's not $1 million company. And will we be in a position a year or two down the road to really be able to provide health care for those of us that, work for the union? Through this struggle a couple of years ago, again, I really started from the point that what was really important was my family, me, and all of you that have ever been through this know that you're just overwrought with thoughts of your family. And I now am continuously saddled with medical bills. I worry about the face of this plan, what will happen. And as I was explaining to some of the people that I work with, people often ask me, am I suffering from carpal tunnel? As a result of the chemotherapy, many studies that chemotherapy affects your bones. I have no reason at the age of 49, minus family history, to have suffered from any type of osteoporosis disease. 14 months ago, I fell off of a stool at my house, kitchen stool. I think many of us in this room have probably done it, and ended up literally pulverizing my wrist. I have now gone through 5 surgeries, and the other night, my husband and I were looking at the bills, and the surgeries alone have now cost $92,000, and that is without, prescriptions or anything else. And when I look at this, it really frightens me to think about taxes and what comes out of my pocket, and I might face bankruptcy, frankly. I have a snowmobile, I have all the things that my husband and I worked so hard for, and am I going to end up there where I now worry when I see our members, but now I'm the face of it. I see myself every day, and I wonder, what is going to happen. So we have the experts here. I know that we'll do all of the statistics, but I really, really want to remind everybody, and I was willing to do this because there is a face to this. This is not only statistics. This is not, just about plans and politics. This is about real human beings that have faces, get up every morning, as I do. I think after all this, a very changed person. I don't think you're ever the same after you go through this kind of struggle. But again, just never, let's not think about there's no faces to this, because there is. And I want to be here to share with you. And it is my face, but it is everybody's face here. And I don't think we need to forget that as we talk about statistics and what we are facing with Senator McCain's plan. So thank you very much.